Okay guys, so we're here in the morning. You're gonna follow along with me. A full day in the life. Today we have 2 surgeries and some consults, follow-up patients. It's gonna be busy. Stay tuned. So my busy days always start off early in the morning. 6:45, I gotta get right. And so I head straight to the break room, and I always start my day off with a little bit of AG1. AG1 is a health drink. Basically, it's a green drink that combines everything you need to feel mentally clear and just gets me ready for surgery. I don't always have a lot of time, but this is something that I found really makes me feel great. My gut feels better, feel more mentally clear, and I really feel like I need less caffeine. AG1 contains probiotics that help work to support your body's ability to break down food, help with bloating, gives me energy so I don't get any crashes from coffee, promotes health immune system as well as mood. So for me, I've been using this for like the past 8 months. I find that it's amazing. I found the difference really 1 or 2 days after starting taking it. I felt more mentally clear and just had a more regular maintained mood. I put my parents onto it and I believe on it that much. And as I get ready to kind of start my day, it's something that just really, I feel like helps my overall performance. So if you're interested in trying AG1, check out my QR code. If you'd like to subscribe, you can save $20 on your first subscription to AG1. Check it out, guys. I really love it. So back to the business. All right, so we're back at it. Every morning, we get everything ready before a surgical case. Got my anesthesiologist, my OR nurse, and my scrub tech, just getting everything signed, making sure all the prescriptions are drawn, all the equipment is set up, all the instruments that I need to make the magic happen. At this point, I'm usually signing paperwork, I'm reviewing the plan with the patient, and going over any last minute questions, talking to them about the recovery process, and taking last minute photos. That's usually when you're seeing me make my marks. So now I'm gonna get ready. I'm gonna put on my shoe covers, I'm gonna put on my glasses, I'm gonna mix the medication. I like to mix the medication myself because that way I know what I'm putting into the patient, and that way I can't be mad if there's an issue. So it just makes sure that there's extra safety steps. Here you're seeing me mix up my local anesthesia. So this is what I use to inject into the face to allow me to take fat for harvesting and injecting. I'm making sure all of the paperwork is signed, reviewing the patient's records one last time, making sure all the I's are dotted and all T's are crossed. Very meticulous, making sure that we review all of this together as a team. Now I'm gonna put on my loupes. So my loupes are my special goggles, which allow me to kind of zoom in. So I make sure those are nice and clean so that I can see everything beautifully, get a really nice fit. Then I just make sure that it fits really nice and snug to my head because I use these things basically every time I do surgery. The mask has got to fit well. Then it's time to scrubby dub. So it's time to get ready to do surgery. I've got to make sure my hands are nice and clean. So it starts off with a nice surgical scrub, getting my hands nice and wet. And then we use a very meticulous surgical scrubbing technique to remove any debris, get my hands really nice and clean. We do this process every single time we go into the operating room, and it allows me to clear my mind and make sure I'm really focused and ready to operate at the highest level. Really gives you a chance to just focus. And then it's game time. Walk into the operating room, I dry my hands, making sure everything is ready to go. In this first case, we're going to start off with a lip scar revision. I've got my gown on, I'm getting my gloves on. This is almost like my Zen zone, guys. So you can see we're like a Formula One team. Basically, everyone has a purpose, everyone has a place. This process happens every single time I do surgery. Everything is getting set up, last minute instruments, measuring. Patient's already asleep, anesthesiologist put the patient under. And now I've got them in a nice, beautiful position. I'm gonna start by injecting local anesthesia, and then it's time to pick up the blade. This is where the magic happens. So this is my, basically my paintbrush. At the time, it's full focus mode, 100% present in the moment and trying to create a beautiful beautiful result from my patient. In this case, this was a patient who flew all the way from Georgia for a lip scar. Unfortunately, she had an accident and she developed a keloid. So a lot of doctors couldn't really deal with this. So I said, you know what? I would love to help you. I don't rush. I take my time. I get it done. Now that surgery is done, we're going to make sure the patient's nice and clean and dry. I'm already happy because it already looks great. Little stretch because it's a long day. Now it's time to go meet with the next patient. So reviewing the schedule, making sure everything is set. Knock, knock, knock. Hey, it's Dr. Truesdale. You ready? So it's time to talk to the next patient, review her consents, marking, and the process begins again. All the while, my OR team is making sure everything is nice and clean and ready to go, nice and sterilely for the next patient. So all equipment gets reprocessed, instruments washed. You can see Cynthia, my surgical scrub tech, and Nurse Rachel there making sure everything is spick and span. I go over to the procedure room, the clinic room, just to say hello to the rest of the staff, check in on them. Hey guys, need any help? Usually at this point, I'm reviewing any kind of questions they have for me, because at the end of the day, I'm running a business, guys. So in between doing the surgeries, I go and check on the team. Now I go back in and check in on the first patient, seeing how her vitals are, how's she doing, how's she recovering. A lot of moving pieces, guys. More questions from my PA, from consults and follow-up patients. Basically, it's like an orchestra, guys. It's everyone is a well-tuned instrument working together. The anesthesiologist going in to meet with the second patient. And then it's time to get ready. Scrubby dub dub for the next case. So I'll put on a new mask, making sure my instruments are processed. Everything is ready to go for the next surgical patient. Super excited. One last check-in on the first patient. She's doing well. I'll give her family a call, making sure that they're nice and happy. The nurse who's taking care of her will be spoken to. Then it's time for me to mix the medications for the second surgery. So I've got my equipment, a little bit of lidocaine. The second case here was a deep plane face and neck lift, an upper blepharoplasty, fat transfer, and buccal fat removal. So I'm kind of getting mentally prepared, getting my medications drawn up again. I do this every single time, guys. So even though it seems kind of painstaking, it's something that allows me to kind of just refocus, recalibrate, and make sure everything is perfect as much as it can be. Here you can see me drawing up a little bit more medication. On the next patient, I want to put up photos. So I really want to see what she used to look like 20, 30 years ago, and I'll put up her current photos next to that as a reference. Team, again, all the new instruments are processed and sterilized. And now we're setting up again for our next case. So you can see all of the teamwork, guys, the teamwork that goes in. So now, second scrub, scrubby dub dub, getting ready for the second case, a nice little deep breath, ready to get go. And now it's game time again. So my job is one where every single day I have to bring it. This is like my Madison Square Garden, guys. Every single time, every single patient requires 150%. And so even though I'm doing 2 patients, all of my focus now is on the second patient, and the team is back at it, getting me ready to go, prepped, my gloves on, ready to go at it. We're back in the surgical theater doing my thing. Surgery's done. Let's go talk to her family, make sure everything is looking good. Take a little lunch break, debrief with the team. At this point, I like to review and think about all the things that I did during the surgery. We talk about what we saw, what we loved, what we maybe can optimize for the next. I'm gonna head back upstairs to my second office to see some more patients. So I'm going to start off with a follow-up patient. She's 1 week after surgery, so I'm reviewing the note. Really excited to see these beautiful results. Hey, good to see you. She's a beyond the surface patient, so she's going to be on our show. If you haven't checked it out, guys, be sure to subscribe. Check out our show here on YouTube. I'm going to check in on her incisions, making sure she's healing nicely. She looks amazing. Still a little bruised. A little scabbing and crusting that's there is basically from the CO2 laser that she had done. All of that's going to flake off. Reviewing with her all the things that she needs to do. Giving her a little lymphatic massage just to help her a little bit with the swelling that she's got going on. Being very gentle. So now it's time for me to see my other 2 consultations. So these patients unfortunately didn't give consent to be seen, but during a consultation, I'm basically just, reviewing what questions they have, telling them what I can do to make them happy. I'll give them information about the surgery, give them information about any risks, benefits, and we'll talk about the different things that I might be able to offer them. Now it's time for a team meeting. We start off with a team win. And you can see all the team there together, making notes, coming up with the plan, reviewing the performance over the last week, and any goals or key metrics that we're going to review in the upcoming weeks. Everyone is on their phones, taking notes. Long day started with surgery, then some patients, follow-ups, consults, and now have to round the day out as a business owner and as basically a boss. All right, guys, so it's 6 o'clock. I'm on my way home. It's been a busy day. Thanks for joining me. See you later, guys.